After more than 3 years, the COVID-19 national emergency officially comes to an end at midnight tonight.
This comes as weekly COVID-19 cases and hospital visits are down drastically from previous years. When health officials declared the public health emergency in January of 2020, no one could have imagined it would have lasted 3 years, nor could anyone imagine COVID claiming the lives of more than 1 million Americans. The vaccine and new treatments has finally helped the public health emergency come to an end at midnight tonight.
For some people, this is going to seem very arbitrary and accelerated, that the emergency part of this pandemic is coming to an end. For other people, they're going to say, hey, look, months ago, maybe even a year ago.
Here now to discuss the changes we can expect and what all of this means since the pandemic is now over after 3+ years in Michigan. This is Dr. Abdul El-Sayed, Director of Wayne County's Department of Health. Thanks so much for joining us today.
Honored to be here.
So what does all of this mean? Of course, the pandemic is officially over, but COVID is not gone. It's here to stay.
That's right. That's what can be confusing about this moment. COVID is here. When we talk about a pandemic, you're talking about a technical definition of a disease that is spreading more than you otherwise would expect. We've been at this for 3 years now, and if you look at the number of cases, hospitalizations, and deaths, they're down as low as they've been in the COVID era. So while the pandemic may be over, COVID is not. And so all of those things that we got in the habit of doing, making sure that if we feel sick, that maybe we social distance, stay home, really thinking a bit about folks who might be at high risk, those are still really important and thoughtful things to do. The other thing I'll say is that the FDA and the CDC just recommended another round of bivalent boosters for people over the age of 60 and those with certain chronic diseases that compromise their immune system. And if you fit in one of those groups, it's really important to protect yourself. So while the pandemic or the public health emergency may be over, let's not confuse that for COVID being over.
So let's not let our guard down per se, but people that are contracting COVID-19 and test positive, it seems as if, at least now, the symptoms are not as bad. They're way more mild than they were, let's say, 3 years ago.
Yeah, that's true. So we're talking about a disease that almost everybody has been exposed to at this point. So no matter who you are, you have some immune exposure. So your immune system isn't caught off guard in the way that it was when this was still a new disease to humanity. But at the same time, right, there's still really the risk of illness. I mean, 250 people a day are still dying across this country of this disease. So I wouldn't take it for granted that you're going to have an easy case. For those of us who are privileged enough to be generally pretty healthy or young, that's probably true. But you also don't know who in your social circle you might spread it to. And so you don't want to take that risk. So what I'm saying is, right, so many of us have gone back about our daily lives. We're eating in restaurants again. We're enjoying time with one another and loved ones. And that's amazing and fantastic. And really, we owe a real debt of gratitude to all the scientists, all the doctors, all the public health folks who made that possible. But also, let's make sure that we're protecting ourselves and our loved ones even yet as COVID is still hanging around.
You know, some of the world's top scientists had been warning for years that something like this pandemic could happen. They are still warning that something like this could happen again. Do you think we're in a better position now than we were 3+ years ago to respond to something like that?
I think we have a choice to make about whether or not we want to be. I think for folks like me who work in public health every day, we saw what was possible when people decided that we wanted to mobilize to invest in public health and health care. We saw what that high water mark looked like. The worry that I have is that when we demobilize this, right, folks kind of want to just turn the page as if we weren't caught flat-footed the first time. And so what we need is a set of investments in public health institutions across this state, this country, to make sure we are ready. And I'll tell you that at the County Executive Evans has made a focus in the next term of really building the kind of public health resilience and preparedness that we need and deserve for folks who are residents of our county. And I think that has got to be the focus for us as a county, but also as a state and as a country.
I remember early on in the pandemic, my daughter's pediatrician said this is going to go on for years. And we looked at her like she had 20 heads, right? Yeah. Did it need to take this long? In hindsight, it's 2020, but did this need to take this long for us to finally say the pandemic is over? Could we have gotten here earlier?
So if all of us as a community had come together and said, you know what, we're going to get vaccinated. We're going to do what we need to do to protect ourselves. We could have been here a lot earlier. Unfortunately, not everybody made that choice. And there was a big effort to demagogue the vaccines, for example, to make people afraid about whether or not you should actually take these. And that really did slow us down. And the thing about public health is it's public. It takes all of us
slow us down by how much? A year or
It's really hard to say, but when you think about it, the advent of some of these newer variants that kept this virus going, whether it was Delta or Omicron, a lot of that comes down to a failure to get folks vaccinated, and that happened abroad, but also happened here. So it's hard to really say. And the thing about a pandemic is it only kind of ends in hindsight. You kind of look at it and say, okay, I think we're there. But we need to, moving forward, come together around addressing some of the mis and disinformation that kept this pandemic persistent and interrupting our lives.
Yeah, there was a lot. Let's talk more about just going forward, what actually changes with this change in declaration.
So there's a couple things. Well, the good news here is that no matter who you are, there's going to be a pathway to you for free at the point of care access to vaccines or treatments or testing, and that's really important. The challenge is that a lot of folks, look across this country, 5 to 14 million people may lose their Medicaid coverage. So for low-income folks who are covered via Medicaid, recognize that continuous enrollment, that thing that kept you enrolled for the 3 years of the pandemic, that's going away. And it's really important that you re-enroll to make sure you have access to health care. The other thing that's going away is a lot of the data infrastructure to gather and clean data to let us know where we were in the pandemic. That's going to start to abate. And the one worry I have about that is that this virus is shifty, right? It evolves. And part of the challenge is if we get another variant that is more transmissible, potentially more deadly, maybe immune evasive, right? It evades our immune system. We might not have the data infrastructure to know about it. So folks in departments like mine are really thinking a little bit about how do we make sure we stay ahead of this virus if it does in fact change. But for folks out there, look, this is a day for us to step back, to remember what has been lost from this pandemic, but also to be asking how do we make sure we never get there again. And for now, it's beautiful weather outside. I hope folks will enjoy it.
Yeah. Well, Dr. Abdul El-Sayed, thank you so much for coming in tonight and sharing this with us tonight. We appreciate the insight.
My privilege to be here. Thank you.
Thank you.